Is safer sex different for LGBTQ individuals? Imagine a world where everyone feels confident and safe about their sexual health. Well, that starts with understanding how safer sex practices can be tailored to different communities. While many safer sex principles are the same for everyone, LGBTQ individuals often have specific needs based on their sexual behaviors. For example, anal sex is more common among men who have sex with men and some transgender people. This activity carries a higher risk of HIV and other sexually transmitted infections because the lining of the anus is thin and can tear easily. Using external condoms or internal condoms, also called female condoms, is essential to reduce this risk. Be sure to use water-based or silicone-based lubricants to prevent tearing and make the experience safer and more comfortable. Always switch condoms if you change from anal to vaginal or oral sex to prevent transferring infections. Oral sex is another activity that requires attention. It has a lower risk of HIV but can still transmit infections like herpes, syphilis, human papillomavirus, and gonorrhea. Using condoms on a penis or dental dams over vulvas or anuses can cut down on exposure to bodily fluids and skin contact. Avoid oral sex if you or your partner have cuts, sores, or recent dental work, as these can increase the risk of infection. Sex toys are popular in LGBTQ communities, but they need proper care. Always put a condom on a sex toy before use, especially when switching between partners or orifices. Cleaning toys thoroughly with soap and water after use is also key to preventing infections. Regular testing for sexually transmitted infections is vital, especially for those with multiple or anonymous partners. Testing every 3 to 6 months is recommended for many LGBTQ individuals. Open conversations about health and testing help keep everyone safe and informed. HIV prevention tools like pre-exposure prophylaxis and post-exposure prophylaxis are also important. Taking pre-exposure prophylaxis daily can significantly lower the chance of HIV infection. Post-exposure prophylaxis, taken within 72 hours after possible exposure, can prevent infection if started early. Communication and consent are the foundation of safer sex for all. Talking openly with partners about health, testing, and boundaries creates a respectful and safe environment. In the end, the core ideas of safer sex, using barriers, practicing good hygiene, testing regularly, and being honest, apply to everyone. But LGBTQ individuals often need to add specific practices based on their sexual activities. Using condoms for anal sex, protecting during oral sex, caring for sex toys, and utilizing HIV prevention methods all help support health and happiness. Remember, staying informed and communicating openly makes safer sex effective and empowering for everyone.